When communicating with a patient, begin by identifying yourself and establishing your role by saying, "My name is," insert your name here. "My name is Keith, and I am an emergency medical technician trained to provide emergency care. I am here to help you." Address the patient by the proper name, Mr. or Mrs., for example, Mr. and Mrs. Smith. Ask the patient what he wishes to be called, and then ask for permission to use this name. Do not use words such as hon, honey, dear, sweetie, sweetheart when speaking to your patient. Phrases such as these can be interpreted as disrespectful or unprofessional. I understand this is how the book addresses that. I've had discussions with providers in the past, and I really have, little feeling one way or another in this topic. Personally, I address everybody by Mr. and Ms. No matter when I'm talking to them. That's just how I was raised, how I was brought up. That's how you address people. However, I completely understand that some people are, especially in smaller communities, they become more comfortable when providers talk to them in more common terms. So honestly, I will leave this up to you to evaluate and to develop your own habits, to develop what habits you deem appropriate for your service, for where you're working at. And keep in mind, this will be different where you go. I can tell you, working in urban and working in rural environments, that the way you communicate with people, the way you address people varies. So it's important for you to be conscious of where you're at. The size of a person's personal space can change depending on who they are with, but they may feel threatened when others arrive inside their personal space without their permission. When talking with a patient, it's important to consider the distance between you and the patient and recognize that a comfortable distance differs among cultures. Many of the tasks of an EMT will often occur within the boundaries of another's personal space. It is helpful to take the time to explain procedures that intrude on another's personal space before beginning the procedure. If you do not, the patient may become agitated, nervous, or even aggressive as a result of the EMT's actions. Here's an example of public space, which is greater than 12 feet, and social space, which is 4 to 12 feet. Much of our patient interview occurs in the social space. However, as you'll see as we go along, when you have to do more thorough assessments and evaluations, you will be in the personal space. As you can see here, personal space, which is 1.5 to 4 feet, is where a lot of our physical assessment occurs. This is where you're going to be obtaining vital signs. This is where you're going to do a head-to-toe assessment. Especially into the intimate space, which is the 1.5 foot range. This is when you're going to be assessing the ABCs. This is when you're going to be palpating